Hello, everyone. My name is Dr. Michelle Nelson, and I have been a proud commissioner on the Georgia Commission for quite a while. We're so excited to be here with you this evening. I'm going to introduce to you my fantastic commissioner colleague, Ms. Karla Jacobs. We're so excited that we're able to serve as commissioners. And today we're going to be speaking to you about advocacy, which is our jam. Oh, we love advocacy. Isn't that so, Karla Jacobs?
That is so. So I have been a part of the Georgia Commission on Women since 2012. So I have been on a little more than a dozen years. And I've learned a lot about advocacy and working through the commission. I also serve on behalf of the commission on the statewide human trafficking task force through the Criminal Justice Coordinating Council, and have been able to be an advocate for human trafficking issues as well. So learned tons of things, and I'm excited, Michelle, that you are going to get to talk for a little bit about advocacy, how to be an advocate, and best practices and strategies.
Yes. And so just a little bit more about me. I am the proud director of graduate programs at the mighty Clayton State University. I head up the family nurse practitioner program, and I wear a lot of hats. I am an academician, I am a researcher, I am a practicing clinician, I am a motivational speaker, I am a leader. I mean, it's a laundry list. But what I want you to know about me is, most importantly, I am a nurse. Happy Nurses Week, everyone. And I am a proud advocate for access to healthcare, and not just any old healthcare, quality, safe, cost-effective healthcare. And Karla Jacobs, she joins me in that fight. Isn't that so, Karla?
That is so. That is so. And on that note, I have a question for you, Dr.
Oh, okay. Let's get right into it.
Let's get right into it. Looking at a bigger picture, let's start with the 30,000-foot view
Okay.
for a minute. So why is healthcare advocacy so critical today, especially in a state like Georgia?
There's so many different ways to answer that question, but first and foremost, unfortunately, Georgia has the distinction of being one of the best states when it comes to business. We get an A for business. But if I were to put my professor hat on, I would give us a D when it comes to healthcare. Georgia falls near the bottom, if not the bottom, for some of the, or many of the major healthcare indicators. We fall in the bottom 10th. We have been 50th when it comes to maternal mortality, 50th when it comes to mental health services, access to mental health services. And it's very unfortunate that the state that I love, this is where we find ourselves. And we have to do much better in making sure that the 11,000 plus souls here in the state of Georgia have the access that they need so that they can stay where they live, they play, and they work, for access to optimal healthcare outcomes and the pursuit of happiness and a fantastic life. Healthcare is the basis of being able to strive and thrive when it comes to life here in Georgia.
And we've got, a lot of challenges in Georgia. You mentioned where we are rankings nationwide. We also have, challenges with our rural healthcare system and getting enough funding for that. And I know that the legislature has been working on those issues as well to make sure that all of Georgians have access to quality health care, those in the metro areas and those in the rural areas as well. Um,
You know,
Go ahead.
people don't realize that a lot of Georgia is rural. When you think of
Right.
Georgia, you think of Atlanta, Metro
Mhm.
Atlanta, where there's, movie movies being shot here and so much fabulous living and eating and things to do, but a lot of Georgia is rural. And, I was doing some work on maternal mortality not that long ago, and it said that a lot of women were dying because they, particularly in rural areas, are driving an hour and a half, trying to seek care after having a baby. You hemorrhage and you succumb to maternal mortality because we've had so many issues. Now, I'm sure we're going to get into a lot of the issues later.
Mhm.
And we're very passionate about this. So let's pace ourselves, Miss Jacobs.
Of course, of course. Okay, so let's talk about your personal advocacy style. So you've been doing this a long time. You've been very involved in, working not just through the Commission on Women, but also working with the legislature on getting different bills passed.
Mhm.
What is your personal advocacy style and how has it shaped how you work to influence healthcare policy?
Yeah, that's a really good question. I don't know how to answer it other than to share with you maybe the type of personality that I have that really shapes and drives the way that I approach my advocacy work. So I'm from Brooklyn, New York, just in case you can't figure out that this accent is not a Georgia peach accent, it's a Big Apple accent. And I have been in Georgia for maybe 20 years, but when I came here, I came here to do my PhD in Emory. And up until that point, I had gone through all of my studies and not really been involved in health policy advocacy. It was not something that I was interested in. Like
Mhm.
most nurses, we are working our fingers to the bone, trying to save lives. And when you get off work, you don't have time. All you can do is catch some sleep and head back to the hospital. And it wasn't until after I got my PhD and I got into teaching.
Mhm.
And one of my instructors that worked with me at the time said, Dr. Nelson, I'm looking for a secretary for my organization. And I said, a
Mhm.
secretary, I can help you find everybody. I know everybody. He said, oh no, you. I said, oh, me? I would make a horrible secretary. I don't type anything. I'm not taking any minutes. If I take minutes, I get in my car and turn my reggae music on. They fly out the window. You're never going to see these minutes. I'd be the worst secretary ever. He said, oh no, but it's the energy and the personality. That's what we need. Okay, so I'm going to join your organization and learn more about it. And as I joined and I started to understand the plight of what was happening with healthcare here in the state, I was absolutely awestruck and appalled. Being from New York, we have a lot less barriers on access to care and the ability to practice as a provider. And coming here and seeing that the healthcare landscape was just really poor, that people who were practicing had so many barriers to their ability to just do what they were trained to do, that they have expertise in. They were not able to do it to the highest levels of their education, their training, their certification, their licensure. And that was a really big problem. Not so much so for the provider or the clinician, but for the patients. The patients, you see, are getting
Mhm.
the short end of the stick here. And so as I went about doing my organizational work, I realized that the organization had quite a few issues, as a lot of organizations do when they have growing pains. And the president at that time could no longer serve. And I said, you know what? I'll do it. I had never been the president of anything, the leader of anything, but I knew what I wanted to see in a president. So I was going to serve using those attributes that
Mhm.
I wanted to see in someone who was leading any type of organization. I wanted to have a president that was present,
Mhm.
someone who was available and accessible, someone who was energetic and charismatic, someone who showed up, someone who was willing to answer tough questions, someone who was willing to hold the people that we elected, someone who was willing to hold their feet to the fire and to make sure that the things that they ran to get elected on, that they were going to provide those things that the
Mhm.
people who elected them that they wanted. And so I became that president. I worked extremely hard. I was the president of the Advanced Practice Association for the state, called United Advanced Practice Registered Nurses of Georgia, for nearly 6 years after serving as their secretary. And we saw explosive growth. We saw incredible name recognition. We saw respect for what it was we did for our profession. And we saw people really standing up for not just nursing, but for healthcare and our allied healthcare professionals. We saw them doing that in mass. And so I also decided, you know what? This is not just about me. I also had to make sure that I have a succession plan in place to
Mhm.
make sure that the legacy of all the hard work and the advocacy that we were doing, that that work was sustainable and that it was scalable. And so making sure that I wasn't just leading in a vacuum and continuing to operate in a silo, which a lot of organizations do, but trying to use a very united, collaborative, and that's a key word,
Mhm.
collaborative approach to advocacy to make sure that, all voices are heard. And, I love to share with people that to be a leader truly means that you are a humble servant. So, helping people to understand that we are in a service capacity and we are here to execute the will of the individuals that are part of our organization and the individuals that we serve, which are Georgians. So, my approach to advocacy all the time is making sure that I'm speaking with a loud voice, an informed voice, but it's not just me. Empowering those around me to make sure that they also understand they're confident and they're competent in their ability to speak with a loud voice as well.
Awesome. Tell me a little bit more about what the collaborative process looks like. I know we're going to talk a little later, we're going to get into the nuts and bolts of best practices for advocacy. But when you talk about being collaborative, what does that look like with the people that you work with on advocacy issues?
So, this is a discussion amongst friends, right? No judgment?
No
No
judgment.
judgment here? Okay. So, I was a little crafty
Hmm.
when I began because remember now, I don't know anything, right? I know very little, and I'm just an individual that my movement is based on hard work and gut
Hmm.
and grit. And so I did a search to see who were the major players in Georgia, who were the top organizations, the ones that were the movers and shakers, who were the leaders of those organizations. And I said, okay, I got to be a quick study because this is an organization where people are paying to be members. And I have to um, be able to meet the needs of the organizations, meet the needs of my organization. So, what better way than to go sit at the feet of the other people that are doing big things in Georgia? So, one by one, and I want you guys to catch this as a strategy. One by one, I made a phone call or I sent an email and I invited the people out. Introduce myself. My name is Dr. Michelle Nelson. I am the blah, 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 blah. And I heard that you were the mover and shaker in this town. Everybody was the mover and shaker. Everybody got sauced up and wind blown up their skirt by Dr. Nelson because I need them to work with me. Okay, so I heard you're the mover and shaker. Can we meet for tea? I'd like to learn how you've been able to turn your organization around, even if the organization was three thumbs down. How did you turn your organization around? How do you do your work? Would you like to take me on, please? I promise I won't be any trouble. I'm here to learn. I'm a fast study, and I promise you that I'm going to do the work. And of course, people are so strapped for time that anyone who comes to them and says, listen, I'm here to be a resource, an extra pair of hands, of course they're going to take you on. Of course they're going to train you. Of course they're going to mentor you. And one by one, I went to each leader of each organization. But see, there's a more special strategy that I was using here. When you now are going to all these organizations, by default, you become the hub because remember, they're not talking to each other. They're operating in silos. So you are the connector that learns how this one works and introduces this one to that one. You introduce that one to that one. Being a connector, being someone who is um the individual that can move the chess pieces around on a board, being the individual that everyone is coming to because you're the most important piece on the chessboard, it's always the strongest position. And
Mhm.
the best way to do that is to make sure that you are well versed in what it is that you are fighting for, that you know who the major players are, that you know who your legislators are, and they know you, and that you stand up and you are a stand-up person and you are going to do and fight for what you say you will.
Excellent. And I know you do that every single day. Let's dig down a little deeper into some specific issues or policies that you're working on right now. So, what policies are you following and advocating for right now, or issues that you see are important in healthcare, and what makes them urgent right now in this moment?
Any type of policy, healthcare policy, that is going to ensure access to care for Georgians. That's probably the umbrella over all things that I do. You know, although I'm an advanced practice nurse and our legislation is some of the most difficult legislation to pass in the state, I have an amazing lobbyist who's a fellow commissioner. Her name is Juliana McConnell, who is the most senior female lobbyist under the Gold Dome. And she is extremely intentional
Mhm.
in exposing us to and guiding us in putting forward legislation that doesn't just um, elevate the profession as an advanced practice nurse, but engaging and supporting and following and writing legislation that can be for various allied health professionals. And so we always realize that there's power in numbers, and we make sure that we are working on these issues together in groups. So for instance, as an advanced practice nurse, we have put forward legislation with the physician's assistants, where in the past we weren't, the most likely bedfellows,
Mhm.
but now, um, you work together for the good of the patients and the people that you serve. So, a lot of the legislation that we're currently focusing on is, slowly removing barriers to physician assistant practice as well as advanced practice registered nursing
Mhm.
practice. And when I mean an advanced practice registered nurse, I'm talking about nurse midwives, clinical nurse specialists, nurse anesthetists, and nurse practitioners. And we've even gone so far as to work on legislation this past session that focuses on the ability to get orthotics. Here in the state of Georgia, you can only get one. So if you need an artificial limb, you have one, which means if you're an athlete, if you're going to work, if you got to bathe, if you got whatever, you have that one limb. Now, how ridiculous is that? So horrible to the point that we've heard of people who something has happened to their limb and they had to sit in their bathtub on a bucket to take a shower. Like, this is ridiculous.
Mhm.
And so we joined forces with them. And we're happy to say that just today, our governor signed that bill providing access to additional orthotics into law. We've also done work with Superior Court judges, where in the past, although nurse practitioners and advanced practice nurses in mass are trained to do psychological testing and, you know, we do a lot of training when it comes to mental health, but we were not listed as someone who could provide the assessment for someone who may need to receive someone who's going to help guide them through the judicial system. If someone needs a court appointed, geez, I'm drawing a blank on the word here, but they need someone who will advocate for them. So that bill was just passed and signed into law yesterday, where now advanced practice nurses can help ease that burden to be able to provide individuals that can do that assessment. All right. And so we work on a plethora uh, of pieces of legislation. We have been extremely successful over the past couple of years, where before I started on my advocacy journey and became a leader doing this work and ensuring that others do it too, we had 15 years where there was no legislation passed for advanced practice nurses. And so that is an extremely successful feather in our cap, and we're only getting started because we mean that here in Georgia, access to healthcare is not a privilege for some, but a right for all.
Mhm. Um, Looking more closely at the state of Georgia, what would you say is the current status of healthcare in our state? And what do you think are the most urgent challenges that we are facing as a state when it comes to healthcare?
I don't want to be extremely controversial, but it must be said that in a lot of instances, I don't see where patients and people are put first.
Mhm.
There's a lot of tug of war, turf wars, um, where, you know, access to care is not at the very top of everyone's calculus. So just some quick facts. There's more than 11 million people that live in the state of Georgia. And there's maybe about 30,000, 40,000 physicians. And maybe the same amount of advanced practice nurses. Now, that's nowhere near enough people to provide care for 11 million souls. And when you look at information and statistics that are coming out of the Georgia Chamber of Commerce, we could just use it as an example, when it talks about the graying of America, where a lot of people are going to be retiring, and there are a lot of people who are leaving healthcare, and those slots, those jobs are not being filled. We don't have enough professors and instructors. Even if there are more people who want to come into the profession, we don't have enough people to teach them. And people are about to retire. And so that is a major situation going on here in Georgia, and not just in Georgia. It is a national situation that we are all facing. So finding ways to provide access to care by also working on workforce development, that is
Mhm.
extremely important. Doing creating pipelines and pathways. So reaching back to middle schools and high schools and trying to introduce kids to more STEM programs and healthcare pathways is extremely important. So making sure that there is legislation and that there are funds to be able to bolster and buoy those types of initiatives. So removal of barriers, access to care, workforce development, those are the three top ones that I am laser focused on.
Okay, very good. So looking at those three main issues, what do you think, looking ahead in the 1 year to 3 to 5 year time frame, what do you think are going to be the leading issues in Georgia in addition to those, or would you rank those, or how do you see the what healthcare advocates are really going to need to focus on in the next 5 years?
It's going to be access to care. Access to care is 1 through 10,
Hmm.
and making sure that rural health care has been shored up. There are so many people who are living in rural areas that don't have transportation, they don't have broadband and Wi-Fi, even if we have things like telehealth, which really opens up everyone to being able to liaise with their provider. But if you don't have broadband, you don't have computer, you don't have access, you're not going to be able to do that. So to me, I would say that would be number one, that would be number two, and then mental health, access to mental health resources. There is no reason why such a rich and prosperous and progressive state should be 50th when it comes to access to mental health resources. We need to do absolutely better on that front. All right. And so workforce shortages, access to health care, rural health,
Hmm.
as well as mental health access, mental health resources access.
Excellent, excellent. So that's what as we're talking today with healthcare providers and others across the state, those are going to be the things that a lot of the advocates are going to be focusing on in the next few years.
Mhm. So, Karla Jacobs, you've been asking me all the questions, and I
I-
just been talk. Now, Karla, I have some questions for you. You have
Okay,
some questions?
ask away.
I want to know, for someone who's new to advocacy,
Mhm.
someone who doesn't know much about health policy, someone who says, I'm sick and tired of being sick and tired. I got to be in it to win it. I want to get involved. What would you say would be some of the most effective strategies that they can employ to get involved and to start making a difference for their communities?
That's a great question. I would say the first thing to do if you want to get involved in advocacy is to find out who your elected officials are.
Mm-hmm.
Um, Not just your congressman and your senator at the national level. We tend to focus politically nationally right now, but you're going to want to know who your senator and your representative are at the state level. And you're also going to want to know who your local people are, who's your mayor, who is your city councilman, who's your county commissioner. Um, those folks are very important as well, depending on, what aspect of healthcare you want to advocate for. If you're really concerned about um, being able to have nurses in your schools. You're going to want to know who your school board members are as well,
Mhm.
and be ready and prepared to reach out to them. And it's really important to contact your elected officials. Your voice does matter. I know for a fact that, when you call, particularly at the state level, I know the state level people better because I've been involved with the Commission on Women and working in advocacy at the state level. That, when you call, when you email, um, their offices, your representative and your senator's office, are keeping a tally of who's calling in support of a bill, who's calling against a bill. And so they are keeping up with those things and want to they want to be your voice in government and understand how their constituents feel about the legislation that is going through the process. So you definitely want to know who those folks are and be ready to write or call. And you want to always be extremely polite and open to working with these folks in all of your conversations and your contacts with your elected officials. And you want to let them know, I'm your constituent, and this is how I feel, and this is why I feel that way. And I would like for you to consider X, Y, or Z when you are looking at deciding on how you're going to vote on this bill. Another good way to get involved with advocacy is to join other people who are working on the same topics and issues that you are. So, for example, one of our partners in the maternal child health arena is Healthy Mothers, Healthy Babies. If maternal health is something that's important to you, you might want to check out that organization and see how you can be involved in what they're doing. We work with many different organizations on the human trafficking side. We're on the statewide human trafficking task force. We have worked with organizations, as varied as Street Grace and Out of Darkness, and a lot of the advocacy groups that we work together with on the task force are people that we can partner with, and people that you might want to reach out to and partner with as well to help you. Um, and just, get your voice is important. And even though you're one voice, your voice is still important, because when it's combined with other people who are working on the same issue, your voice becomes louder. What about you, Michelle? What are some things that you recommend in getting started in advocacy?
Um, you got to know your personal senator and representative. If you go to the Secretary of State's website and you enter your address, that information will come up. And as I said earlier, these are real individuals. We
Mhm.
have a citizen-led legislature. These individuals come from all walks of life: insurance, transportation, farming, and they want to hear from you. I firmly believe that people that get elected to office really do it. Now, if they change along the way, that's a different scenario. But typically, when they start out, is because they have a burning desire to serve their community. And in order for them to serve their community and the constituents that have elected them, they have to hear from you. But please believe, if they don't hear from you, they're hearing from somebody. And the
Mhm.
somebody that they're hearing from might be giving messaging that is 180 degrees counter to what it is that the constituents truly need. So the only way to make sure that your voice and your needs are being met is to show up.
Mhm.
You got to be in it. So find out who these individuals are. Actually, this time of the year is the time for you to start reaching out to
Yes.
your legislators. The session has wrapped. It's over. And so the down session time where these individuals are back in their districts, this is the time for you to reach out to them and say, can you come to an event that we're having? We have constituents here that would love to hear from you, and we want to share with you what our concerns are, our topics of interest are, or can I come to your office? Can we meet for a cup of coffee? I mean, a lot of legislators have told me in the past, I have met people at Popeyes, Panera, Piggly Wiggly, any old something. They want to engage with you so that when they get to the Capitol and they have to vote on something, well, they know that they're voting with the best interest of their constituents in mind. Tell them that you're an expert in maternal mortality and that you are willing to be that expert, that voice. If you're about to vote on something you don't know what it is, you can text me, you can email me, whatever it is, trust me, they will. So you can um serve as much as you want or as little as you want, even if your service or advocacy only takes the form of paying dues to an organization so that they have the war chest that they need to be able to go and execute what the organization is there to do. Or if you can do more and you can show up and you can go for testimony at the Capitol, you can do as much or as little, but you've got to be involved.
Yeah, and I would like to just reiterate what you said about now being a really good time
Yes.
to be reaching out to your elected officials. The session is so busy, y'all. They are in the Capitol from like 7 in the morning until, late at night during session, when on the days that they're in session, and on the days they're not in session, they're in committee meetings all day. So this is the time to really reach out. And I've had coffee with my elected representatives. I have, met along with other colleagues with our representatives for lunch, or, just find a time to talk on the phone or have a Zoom meeting. Now's the time to do those sort of things and just introduce yourself to your elected officials, help them understand what you know, what you're expert in, and like Michelle said, so that you can be a resource for them when they're making these decisions. And then during the session, communicate on specific bills through their office with emails and phone calls. And also, another way that you can participate is to join your professional organizations. Michelle was president of the UAPRNs. There's also the Georgia Nurses Association, the is it Licensed Professional
Counselors
Counselors
Association.
Association. I think was the LPCA.
Mhm.
There are all sorts of different professional organizations for, different types of healthcare workers, or even organizations, if you don't work in healthcare, that are working on issues that you're interested in. Those folks can also be a good way for you to participate in the advocacy process.
Mhm. 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 And, I just want to reiterate, shout out again to our lobbyist, Juliana McConnell, and Miss Robin Pinchton, to being able to get, this is what we call our guardianship bill. That's the one I was talking about earlier, where um, advanced practice nurses could participate in the process of having a guardian assigned through the superior courts, and also the prosthetic bill, where individuals are now going to be able to get an additional prosthesis. And, this is going to require additional health care benefits coverage to be able to get that additional prosthetic device. These are bills that were born out of the need coming from the voices of constituents that need it most.
Mhm.
So the other thing, one of the most powerful things you can be is the constituent that has the need. So you're not just the person that's throwing yourself at the legislator to be an expert, but you're also the person going to them saying, did you know that so many people are affected to the tune of this amount of money or loss per year? People like hard facts and statistics. That really drives the point home. So don't be afraid to stand up and not just advocate for other people, but advocate for yourself, your family, and the individuals that you serve.
Absolutely. And another resource is, I want to make sure I get the website right, georgiawatch.org for advocacy resources as well.
Can I give you one more question?
Sure.
Okay. Where can listeners go to find reliable advocacy resources? So we talked about georgiawatch.org.
Hmm.
But to stay informed and stay connected with like-minded organizations. So we have, of course, plug for Georgia Commission on Women,
Absolutely.
and we have 4 pillars. What are our 4 pillars, Karla Jacobs?
Our 4 pillars are, I think we have 3 pillars.
Oh, 3 pillars.
We have 3 pillars. Our 3 pillars are women's health,
Mm-hmm.
maternal and child health,
Mm-hmm.
and human trafficking.
That's right. That's right. That's right. The 4th pillar is all this other advocacy stuff. We're gonna make a 4th pillar tonight. How about that? 4th pillar.
Okay, that sounds good.
Here you go. So, it's organizations like ours and this amazing wellness summit that we've had how many years in a row where we're coming to you and we're sharing a plethora of topics. Make sure that you're getting engaged in other organizations. So don't just now say, okay, I'm going to throw some money at them and be a member. Get involved.
Mhm.
See what they have to offer. Go to the networking events. Go to the conferences. Sign on to the forums. Run for office in your organization. And most importantly, run for office where you live. And it's not
Absolutely.
just state level offices, but you can run in your community, city council. That's going to affect exactly where you live and work.
Hmm.
Community school board, become the mayor. Or if you want to go big, run for something national. Why can't you be the next congressman? If not you, then who? Do it.
Exactly.
Well, Karla Jacobs, this has been such a fantastic time. I feel like I was just sitting in my kitchen, you're sitting in your kitchen, 2 friends having a fantastic conversation about something that we're passionate about,
Hmm.
something that we love to do. This is not our day job. We're not lobbyists,
Mm-mm.
but it is just so powerful to see when your efforts result in something that is so much needed for the individuals you serve, the communities where you live, and the individuals that you love. Okay.
Absolutely. And advocacy is so, it feels good to be a part of that and feel like you're making a difference. And it's definitely worth your time to get out there and get involved in the things that you feel most passionate about in your community.
Yes. We want to thank the Georgia Commission on Women for the opportunity to be a part of the Wellness Summit, to speak to you about how you too can become a successful and effective advocate. We're really grateful to the executive board led by the fabulous Tita Stewart. We invite everyone listening to continue to check out the Georgia Commission on Women and to make sure that throughout the year that you're following us. You can follow us on social media, and most certainly we have events. come out and support us at our events.
Absolutely.
Mhm. So thank you so much. Here's Karla Jacob and Michelle Nelson over and out. Thank
Over
you
and
for
out.
listening.